We've come through the peak, or rather, we've come under what could have been a vast peak, as though we've been going through some huge alpine tunnel. And we can now see the sunlight and the pasture ahead of us, ahead of us, ahead of
It is something of a desperate landmark moment. The UK getting beyond 29,000 deaths and, as you've probably heard, overtaking Italy to have the biggest death toll in Europe.
Can we trust our governments in what they say to us about coronavirus?
No, we can't. This virus has managed to spread through modern developed societies, especially Britain, is a crime.
The biggest death toll in Europe.
In 2016, a drill called Exercise Cygnus happened in London. That was a drill to practice for a pandemic. The result of that was that the health service was overwhelmed. There weren't enough beds, there weren't enough ICU beds, there weren't enough ventilators, there weren't enough clinicians in the right place. The health service, which had been battered by cuts and privatization for years, failed. The chief medical officer then in 2016 asked the government to heed the warning of what they'd demonstrated very clearly, and yet the Department of Health in London suppressed the documents which had the conclusions of this drill. They kept them from going public. Now that is only 4 years ago. So they knew the whole preparedness for this should have been in place.
Biggest death toll in Europe.
But of course they knew they couldn't put it in place because the government had devastated the National Health Service since the 2012 Health and Social Care Act. Privatization had subverted the health service to the point where it couldn't possibly respond as it should have to the pandemic, and we've seen what's happened. Not enough ventilators. The whole concept of mass testing, which has been so successful in other countries, especially Germany, and should have been right across Britain, that's where it's more than a scandal in terms of what this coronavirus has meant to the societies that it has ravaged, and especially for Britain. It's a crime. And when it began in 1948, it was set up to give the British people, and I quote, freedom from fear. We now have a state of fear. The reason is that the National Health Service, the visionary National Health Service, the world's first public health service, was decimated over a period of time, and if you read the Thatcherite documents, by stealth. That's the word they used, stealth. those who have undermined the health service, particularly with legislation in 2012 that allowed in privateers that devastated whole areas of it, and also that the whole social care system in Britain, which was an extension of the health service, was privatised almost entirely, both by Labour and Tory governments, beginning in the 1990s. From my own knowledge of investigating the health service over several years, the NHS would have coped with the onslaught of this virus. There would have been mass testing, all the intelligent application of medical expertise. That would have happened in Britain. It didn't happen because the governments, both Tory and Labour, allowed the health service to be subverted over this time. As I say, it's more than a scandal. It's a crime. Bed capacity in the health service had dropped to 127,000, the lowest in Europe. When you think that when the health service began in 1948, it was well over 400,000 beds. The health service was always proud, and rightly so, that its bed capacity was one of the highest in the world, but cut away to such a degree that the 4% increase in the health services budget just to keep it on track was cut back to 1%. Had a devastating effect. And that's why there is a political reason why people are suffering from coronavirus. Many of them may not want to confront that, but it's so.
The biggest death toll in Europe.
Since the 1980s, speeded up through the years of New Labour, but especially accelerating from 2012 under the David Cameron-led coalition government. Professor Danny Dorling, a very reliable source, and his colleagues at Oxford got into trouble for some thorough research that showed that something like 120,000 people's lives were cut short as a direct result of austerity. And they put their finger on the cuts in the health service. Now, those are actual lives. It's very clear from the countries that succeeded in, if not seeing off the coronavirus, in dealing with it successfully, such as Germany, South Korea, Taiwan, even impoverished Vietnam, certainly in China itself. Why are we not seeing mass testing across the country? Yes, it's happened in pockets and it's happening belatedly, but also it's happening belatedly that ventilators have finally arrived. Now, in that drill exercise in 2016, one of the issues that arose was that there weren't enough ventilators. That's 4 years ago. it's quite clear to anybody who has studied governments in this country, Tory and Labour, New Labour and Tory governments, and their attitude to public health care, that the responsibility lies right at their feet.